In my opinion, there are a few studies which are really great. We had the results of the ARROW study. This is the study comparing once weekly versus twice weekly Carfilzomib. We know this is a second generation proteasome inhibitor, highly effective, but not always very convenient because of the schedule of administration. And this randomized phase 3 trial is clearly showing that we can administer Carfilzomib once weekly with a PFS, progression-free survival benefit. So I think for the near future, this trial will allow to change practice. Obviously, we need to be careful because this is a combination of Carfilzomib and Dexamethasone, and these results may not be true when it comes to triple combinations. Still, in the relapse setting, we've seen in this meeting the results of the OPTIMISMM trial. This is again a multi-center randomized phase 3 trial looking at the combination of Pomalidomide, Bortezomib, Dexamethasone versus Bortezomib, Dexamethasone, and the results are really amazing. These are patients who were in relapse between 1 and 3 lines. Obviously it's randomized, the groups are comparable. Primary endpoint was progression-free survival, and we can see a significant advantage in favor of Pomalidomide, Bortezomib, Dexamethasone. Of course, if we want to be fair, we can criticize the control arm Bortezomib, Dexamethasone, which is approved actually in the relapse setting, not necessarily the most widely used combination. But despite this criticism, I think these results are really very nice, and they will be widely, in my opinion, used and applied, especially when it comes to those patients who are refractory to lenalidomide, because we should not forget that many of the relapse options we have in hand are actually these days combined with lenalidomide, dexamethasone. So it's always very welcome to have a combination which is based on Pomalidomide. So this is really very interesting. We have also seen during this meeting a subgroup analysis from the famous ALCYONE trial looking into Dara VMP, Daratumumab, Bortezomib, Melphalan, Prednisone compared to VMP, the standard of care in elderly myeloma. This was published in the New England Journal of Medicine in January 2008 by Dr. Mateos. And in this subgroup analysis, the investigators focused on looking on the outcome of those patients who were aged above 75, so the very elderly. And interestingly, we can see that the Dara VMP combination is also highly effective and feasible in this very old population. Safety profile is quite acceptable, although one must confess that the incidence of some side effects is slightly higher with Dara VMP. Obviously, this is IV combination. Bortezomib is subcut, but at some point we will have access to Daratumumab subcut. So I think this quadruplet combination is clearly also making it into the field. We are, of course, eagerly waiting for the Daratumumab, lenalidomide, Dexamethasone. Hopefully we'll get the results of the randomized trial, the MAIA trial, within the next few months.